Oh, great. Well, welcome back, everybody. I'm going to keep one eye in the hopes that we might have some cyber questions coming in as well. And speaking of cyber, some of you were probably wondering a little bit why this panel on media hasn't touched too much on social media, which is such an important component of journalism these days. And it's because you're about to have an entire wonderful panel on the topic. So I didn't want anybody to think that we were not including that, but you're going to get the experts. So don't hear it from old dinosaurs like me. I see we've already got a question from one of our commission members. Paula.
Hi, I'm Paula Lance from George Washington University in DC, and I want to thank all of you for sharing your wisdom and expertise with us today. I was happy to hear many of you talk about the need for science and evidence and data. It helps your stories. And I'm a researcher, so that's what I do in my life. And most researchers don't want to just see their work stop by being published in some journal. They want it to be translated through the media and through other venues into policy and practice. But I want to ask you a really frank question about how to better have pointy-headed researchers like me in academic settings work better with reporters. Because I think there's a lot of issues with that. And I've made a long list, I won't read them, but there's a long list of reasons that I've heard from my colleagues, and some of them I felt myself, for why it's difficult working with reporters sometimes.
Ouch.
But I think it's more our fault than yours, so I want your perspective. But we come from slightly different worlds, right? So, and the deadline thing is not that big of a problem, but you work on deadlines, and sometimes people are busy and they don't have time to call you back right away. But there's concerns sometimes among researchers that you might already have a story and an angle you're going after, and our research might not really fit with it, but you'll make it anyway. There's concerns that reporters, I won't personalize it, that reporters, journalists sometimes don't really get the research results right, or they might want to overinterpret what the results are. Also, and many of you spoke about the need to sort of have, sometimes in stories, create some kind of conflict or tension. And so then sometimes we're worried, well, you're going to go find someone who's going to criticize us, and that's going to be embarrassing. So, I mean, the list could go on and on. But I think there's a reluctance among some researchers to get their work out there, even if they've had media training and work with the media relations specialist at their home institution. So any advice you have for researchers would be
Who
much
wants
appreciated.
to tackle that? Karen?
Yeah, thanks for the question. I actually think that you're right about quite a bit of that stuff. I think that there are a lot of journalists who really don't understand statistics, and I know that there's training available. I've had quite a bit of it myself over the past year, and understanding studies, knowing how to read studies. And I think that the advice that I would give you is that you have to really be an educator with the reporters that you talk to. You really have to explain to them the meaning of the results. And I would invite them to read the entire study. I think that's a big thing too, as a lot of times the public relations department at the university writes the press release, and they're terrible. A lot of times they really represent what the results are, or they pick what they think is a way to make it sexy and miss the whole point. So I don't think it's necessarily all the reporters. If we get a press release that has a headline on it that misrepresents what you think is important as a researcher, then we're left to untangle all of that. So one thing that I try to do is always read the entire study, so that even if that might be mentally challenging at times, I read them, because I know that I can't depend on what the university public relations department is saying about it. So anyway, you have to be an educator, you have to be an advocate. I have had researchers say to me, I have had them at times mention a way that their findings could be distorted. They might say something like, now I don't want you to say X, Y, and Z, because that's not really what this is all about. In fact, I recently, in fact, just last week, I did a story about the Ev D68 virus, the first cases being, confirmed in the state of Michigan. I was interviewing somebody And he was talking about how there have been all these children in intensive care and some of them with, on ventilators and so forth. And I said, well, have any died? And he said, no, it's not lethal. And that's very important for you to say. So when he said it that way, that was a red flag for me to know that was a very important thing to say. This is not a lethal virus.
I'm going to turn this into lightning round because I see people lined up at the microphones. So I'm going to come over here. Paula, one thing I would say is when I got one of those pointy-headed scientists on the phone, I would often have to say, how would you describe this to your mother? And then they'd finally get it in a way that I could understand and my readers could understand. Sonny.
First, thank you so much for illustrating good reporting on population health and the issues that matter. So thank you very much. And Ceci, thanks for all your tips about communication principles in our planning for our workshop. So my question is, what would you recommend in the roundtable as we think about going forward and trying to take our outcomes, figure out behaviors that we want people to do or things that we want policymakers to focus on, how we create these relationships with the media? I mean, should we go figure out a network, and try to map this out and then start just going to meet people in the media and build relationships that way? Or should we wait and go with a specific story? And do we have to have the personal face part, or we just need the facts? Or give us some advice about as the round table and trying to influence the nation around this. What do you think our relationship should be with the media, and how do you think about that?
Kate or Michelle?
Well, I have one thought, because, I have sometimes been invited to come in and speak when there's a media training going on for nonprofit folks or academics. And correct me if I'm wrong, but it seems like a lot of the training tells you, pick your message and sort of keep repeating it, don't stray from your script. And I have to tell you that as a reporter, even though we're slow-moving creatures, we can figure that out, that you're being media trained. And those people who totally stick to their script and won't say anything and are avoiding all controversy are the last people we ever want to go back to. And so, in a way, what I'm going to tell you might be somewhat unsatisfying, because I feel like what media training tries to do is give you a systematic set of tools, which I personally, and Kate and Karen can maybe nod or whatever, never follow in my years as a reporter. I'm looking for somebody who I feel like I can trust and who over time I might develop an off-the-record relationship with, who might either one way or the other pick up the phone and say, here's what's going on here. And one thing to understand is there's different levels of speaking, and you can where you're on the record or off the record or for attribution, all that stuff that's highly complicated. But it's not like you're going to have to sit there and get all tangled in that. I think you can just take someone out to lunch. You can look at their stories and see what their sort of interests are and what the kind of things they pursue. I mean, journalists, who are writing enterprise stories are really, as opposed to the parade or whatever. I mean, you can see their interests, and you can see that that's somebody who maybe is going to read the whole study or, something like that. And so I just, I suggest a more personal approach, but I think it's unsatisfying to hear because everybody wants to know the 5 steps or something. But I can tell you that those deep relationships, every journalist I know, and I don't know, Ceci, if you would agree with me on that too, relies on those folks. And the other thing I'll say is that the people who I have seen have really magnificent sort of public health careers are people who intuitively understand that value of communicating with the media, and that they find a way to get past however many times they've been burned, by the folks you're representing with your list, and just, I mean, for instance, there's this guy, Blake, I'm blanking on his last name, he used to be at USA Today, and he partnered with a major research center to do the analysis for, a really data-heavy sort of like study in a way undertaken by the newspaper on air quality, very important. And so the relationships can go from, the coffee or the quick call to really embarking on major public health style journalism.
Let me go over here.
Yeah, hi, I'm Brooks Ballard with the Michael and Susan Dell Center for Healthy Living at the University of Texas School of Public Health. And my question, I guess, kind of dovetails on that a little bit, but you mentioned the success about the Valley Fever Initiative and how you got a lot of different groups, stories, and then eventually you got the national news outlets coming in and wanting to tell stories or kind of give their angle. And my question is kind of, I guess, also to you guys as reporters, how willing are you to share those stories, or how do you feel when, say, a national partner comes in and the person you've been working with kind of transition to maybe a larger, louder mouthpiece? Do you feel burned, or how do you manage that relationship on both sides to really kind of take advantage of the interest, but also not kind of hurt the relationships that you're building? And the last kind of sub part of that is, how do you get more than one news outlet interested? Because my experience is a lot that they want exclusives. They want to know that you're not going to go to another news outlet. They want to know that you're giving them the best story, not holding the best story in case NPR calls. So how do you manage that relationship on both sides?
I think that we probably will all agree that these are stories. If we care about these stories, we want them to be out. Like the Mud River women that I had there, Oprah picked the Oprah Network picked up on them. We were thrilled. And in terms of exclusives, you can get around that if you have your point that you want to do. Find different people to pitch to the different news outlets. For instance, if you have somebody you think illustrates your story really well, don't give that to 3 news outlets. That is really a no-no. Find 3 different people, and to the extent that you can say, here are some people who have agreed, who illustrate this study or this point really well. They have agreed to talk to the news media. We're giving it to you. Let us know if you're going to use this story. Then you'll have success. But the duplication comes and you run into problems when you give the same sources to several news outlets.
Yeah, I think Kate is making a great point about there are always multiple angles on any given story, So one news outlet might be more interested in the economic implications of something. Another news outlet might be looking for the really cool jazzy graphic that's just going to illustrate it in a snapshot. Another wants the local person. Another wants the national trend. So it's just kind of thinking through that different news organizations think differently, approach things differently, and you should be able to get a lot of mileage out of those. Over here.
So good morning, Judy Monroe. I'm roundtable member and from the Centers for Disease Control. So thank you very much. This was a really great panel. A couple of questions. I was a prior state health officer and did have an opportunity to build some relationships with media, and it was very productive. I really enjoyed that on multiple levels. A couple of questions. So for Kate, with the series you did, what was the role of the health department? Did you have a partnership with them? Did you go to them for information, or were they very involved? I'm not sure I saw the health department in your list of partners.
The health department's a partner in Try This, which is the community. As a matter of fact, they're a funder for some of the mini grants. But we felt that it wasn't appropriate to partner with them for the shape we're in as a journalist, because we cover them in many respects, and also within the series we were critical of them. And so that wouldn't have worked.
Right, fair enough. And then to kind of dovetail on this, so that relationship, or because I like the advice of proactively going, not when there's a crisis, but going and talking, to the reporters beforehand. Is that, with what we want to do with the population roundtable and where we're headed, is that more effective with individual relationships, or would there be a group, and have you done that, like with a small group of voices from the community that would take this on? Because I could envision across the country developing out some series of articles in different local newspapers. Which works best?
So just to make sure I understand, are you talking about like IOM would have a message that they would want to communicate to a group of journalists, maybe? Or?
Well, no, I guess I'm thinking more locally.
Okay.
That the IOM, certainly the roundtable may have messages that would go out, but then locally,
right.
Maybe a group of 3 or 4 really committed individuals, but from different sectors. Would that be more effective, working with the local media and building that relationship to kind of carry the story forward?
I think that would be very effective because, and maybe Karen might want to comment on this too, but just the idea of the tremendous time pressures that journalists are under, but at the same time, people are really hungry for insight. And so you could arrange like an off-the-record chat
Yeah.
Now, would you invite 3 competitors? I mean, would there be 3 competitors in that market? It's an interesting question, but maybe it's even across sectors like business, health, whatever. And I think people would feel honored maybe if you were reaching out to them that way. Let's have lunch together and stuff. And since you're not doing it in a moment of urgency,
Right.
I think it would be very well received. But Karen, do you want to comment on that?
Yeah, I think I agree with Michelle. I think that would be helpful.
Okay, thanks.
I see
I'll
3 more.
add one thing to that, which is that as we find people networking, they learn about each other also, and so.
Great point. 3 more questions I'm going to quickly try to squeeze in.
I'll go quick. Ceci. Hi, Michael Manganello. I guess I consider myself a patient advocate, consumer advocate. I run advocacy campaigns and I'm not part of the Roundtable nor the Institute of Medicine. But I guess my question is, it was really, everything was fascinating what you did. You clearly created change in your community, and whether it was valley fever or obesity or premature deaths in children, but they're very specific medical problems. And I think the challenge to me, I just have a question from your perspective, the challenge for the Roundtable is that population health and the social determinants of health is really complicated. And I think what they need to do is create a movement personally. But what's going to be interesting to you about how do you sell solving poverty, income disparity, hunger? That's what would be interesting to you, because that's a big issue. And how do you sort of bore it down?
How can they sell it to you, ladies?
How could that? Thank you.
Well, in the case of Detroit, I think that there are many facets to it, but focusing on just the population of children, I think that kind of narrows it a little bit. And what I'm hoping to do is get people focused on children and thinking about all these different impacts on their health. And the community engagement event, the luncheon that we're going to be giving with funding from the USC Annenberg, is going to gather a small group of key leaders across a really kind of a broad expanse. We're going to have foundation leaders, neighborhood watch groups, we're going to have mothers, and we're going to have city officials there to try to build some kind of unity around we need to do something to help our kids.
I think there are models out there for that. I agree that the children is, they're a microcosm that does narrow it. Where I'm in West Virginia, there's the West Virginia Healthy Kids and Families Coalition that runs Our Children, Our Future, and they gather together regional gatherings of stakeholders who represent many different aspects of population health, and they talk about it, and then they prioritize their priorities for their region, and that gives people a sense of empowerment, and I think that model is something that could translate well over to the IOM.
Yes, sir, over here.
Well, I just want to add one thing quickly, which is when you describe something like hunger or poverty, it's too big. Like, would you read a headline in your paper that said, we're solving hunger? I mean, maybe you would, but...
No,
you know what I'm
that's the question to you, because that's the solution to population health.
I think that thinking local and really trying to bring to life what's going on in a local community and to map out where things went wrong and where things might go forward makes these things feel more tangible and concrete. Just as on a kind of personal level, having those stories sent in about how I got back on the treadmill make you feel like you can do something. It's too big if it's just that amorphous.
Yeah, overwhelming. Yes, sir.
Jose Montero, member of the Roundtable. I come from New Hampshire, where I am the state health officer, but I am the immediate past president for ASTO, the Organization of State and Territorial Health Officials. Two of the key points were already made, so I'm going to jump to a third one. For people in my position, we have what I would describe as an interesting relationship with the media. Some days we feel that we are the target, not the source or the topic of the news that is being covered. Now, I have been incredibly lucky. This is not personal, because I have a great working relationship with the media in my state. But there was a comment that I find interesting that may not apply to people like me. I cannot ever imagine that I can pitch a story to one or two outlets. That may work maybe for an academic center, but if I, as a public official, pick favorites, I'm dead. I don't know which one of you would like to know that I didn't call you but called Jenny or Mary or Peter instead of talking to you. And as you need to do that to cover stories, how do you better target your stories and the whole thing that you are trying to work on to make it palatable to different angles and sources and interest?
So that's a good point. A public official obviously has a different duty to the public in terms of disseminating information. Any suggestions for him, though, about reaching those multiple audiences?
I just think, Ceci, you can answer this question better than anyone because you're in Washington where public officials
Do that every
selectively
day.
lead. Yeah.
It hasn't stopped the White House for as many years as I've been in Washington, but no, I think you are taking the good, appropriate position here. I think that there are different types of stories. There's a very straightforward news story, which is simply you, the public health official, are putting out important information that you want to disseminate broadly. There are other times, though, when you might be working with one news organization on something that's a little bit more of an enterprising project, like the projects that you've heard about from these women today, where frankly not every news outlet in your state is going to do that, but you find the one that is willing to, and you work, you provide them with information, you do interviews, et cetera. So I think that it just varies on the circumstances and how you do that. And I want to be mindful of our time. Yes.
Yes, at the national level, the organization that I just mentioned, ASTO, awarded 2 weeks ago a national award to a reporter, Ellen Gabler from the Milwaukee Sentinel, in a story that she did for the whole country on how we are dealing with neonatal screening. And she called every single state across the country, got answered some places, didn't, and others. But she ran a national story that made us change practice.
Yeah.
That is incredible, and that is a great example of a working relationship that will improve health outcomes, even if it didn't portray us all in really good light.
And that project's won a lot of awards. I highly recommend it. Let's come over here.
Hi. Two quick comments and a question from someone who's been on both sides of this. Since I'm currently do communications for Prevention Institute in Oakland. My name's Rob Waters, by the way, and had a 30-year career as a journalist. The first comment is that when in talking to reporters, kind of echoing what Michelle said, trying to spin reporters from the beginning and having your frame that you think is what you were trying to pitch and continually repeating it is totally doesn't work. It alienates folks and they see through it very quickly. And I get pressure to sort of do that as a communications person. People are saying to me, well, what's the frame you're going to give them and how are you going to have them do the story? And you have to develop relationships with reporters. It really is about relationships.
Rob, what's your question before we have to pull out the hook?
Okay.
Sorry.
So the question is, the Detroit. I was really interested in the Detroit News series, and it reminded me of a series that and I mentioned this to Karen during the break, but it reminded me of a series that the Detroit Free Press had done about 20 years ago called Children First, in which they decided to highlight every child that died in Detroit, was killed in Detroit by violence. They highlighted, they did big front page stories. And what struck me was thinking about the fact that was great journalism, but it didn't have the enduring impact. And I think it's partly because it didn't have what the West Virginia work has, which is the combination of great journalism and storytelling combined with efforts that are, the kitchen sink approach, which is all of this different work happening at the same time from different agencies. So the journalism complemented and supported and was supported by the broader social work, essentially. So that's the question. The question is there, can this work? Can journalism itself alone have that kind of impact? Is that?
Well, I think that's what we're trying to do with our community engagement event. And I think that it's the intent of our newspaper to continue this coverage for, a significant period of time. We don't have any intentions of stopping with, what we've already published. And what I am seeing is that foundations are really kind of coming to the rescue of newspapers, I think, to a certain extent now that our funding is so low and our staffs are so low, with help like what we've gotten from Kellogg and from the USC Annenberg.
Do we have a final question from online?
We actually have two final questions.
Oh, goody.
One's from Alexandria Brooks from the Center for Closing the Health Gap, which is based in Cincinnati. She'd like to know, what are some tips for an organization that has no media department to help create content that is interesting to the media and that can get picked up by the media?
Depending on what your subject is, find ways to illustrate that through people's lives and draw what I call the spider that has a lot of legs around it, and you just kind of look at it from every possible point of view. Who is affected by this? Who are some of the actors? Who are the people who carry this out? Who are the ground level people? And in each case, suggest to the media various stories that they might run and give them the opportunity to talk with you and tell them what it means in people's lives and give them specific people that they can interview.
One more?
This is from Craig Lefebvre. He wants to know, does using population health concepts and language present problems for you writing for the public?
Is that a challenge?
You know, it was interesting to hear the conversation about the phrase population health earlier. I mean, this is tricky, but I think that population health is not as bad as social determinants of health in the jargon category, you know? And I think that the whole zip code, tell your health by your zip code, which the endowment and Robert Wood Johnson are doing a lot, it has been adopted because it's more tangible. I mean, we honestly advise journalists to leave out all those kinds of phrases. I hate to tell you guys that because I know how hard you work on them. But to bring alive what is really happening, the meat behind that. So
I was struck that in their three presentations, I'm not certain I heard the phrase once.
population health, or
Yeah.
But I wouldn't have you totally give up those terms because it's really important that we understand those concepts as reporters, even though we might not use those words when we report the stories, because learning about those things when I was out at USC, as I said, gave me a framework of how to look at a population health problem. So use those words with us and just kind of trust us to not use those when we write our stories.
Mm-hmm. And sometimes, too, as I've used the phrases, if I think that the readers are going to run into them and they need to know it, I just put a little definition in.
Yep, but excellent advice. So to wrap up, I tried to sketch down a couple of takeaways that I think I heard in our conversations here with this wonderful group. Build relationships with reporters sooner rather than later. Treat them as you would any other professional that you interact with. Build that trust over a period of time. Repetition, repetition, repetition. Use plain English, as Kate said. Back it up with data, as Karen did in her project. Michelle pointed out, think local, but I would also say that sometimes you can sell something, as we talked about the Minneapolis one, of nationalizing. So you can actually take it in either direction. And my own, too, unsolicited, don't forget about healthcare companies and employers and the roles that they play in this. We have some of those folks in the audience today. I'm reminded that Time Warner is giving out Fitbits to thousands and thousands of employees and have all sorts of contests running right now and awards and prizes, and that's a community. It may not be a zip code. It could be an online community all over the world where they have people working. But think about how you're involving them in this conversation and this effort as well. And finally, I'm going to close on a provocative note, and that is don't be naive that population health is all feel good and that there's no opponent or opposition to it. I think somebody even remarked today, well, who can be against obesity? Nobody's against obesity, but there are a lot of food manufacturers that are making a lot of money right now off of producing products that contribute to our expanding waistlines. You have to be cognizant of the entire landscape out there and how you are either going to reach out and collaborate with some of these individuals or how you're going to neutralize them or whatever the level of engagement is going to be. But I think you will do yourselves a disservice if you simply say, population is health, everybody's great, everybody's for it, it's wonderful. That, I want to thank our fabulous panel and call Sandy back up.